Which is more painful, vaginal delivery or cesarean section? Today, let me introduce the principles and processes of these two childbirth methods to you. First, let's talk about cesarean section. There are many preparations before a cesarean section. The parturient needs to undergo various examinations to ensure that no accidents occur during the surgery. After entering the operating room, the surgery doesn't start immediately. Instead, the urine in the bladder needs to be emptied first, because a full bladder will affect the surgical operation. Then comes the link of administering anesthesia. The parturient needs to be in a state of spinal anesthesia, that is, anesthetic is injected into the waist. It is worth mentioning that the anesthesia needle is not too long, only about 4 to 6 centimeters. Before long, the anesthesia will take effect. When the lower body of the parturient has no sensation at all, the doctor will officially start the cesarean section surgery. He first disinfects the parturient's abdomen, then makes an incision in the abdomen. At this time, we can see that tissues such as the skin, subcutaneous tissue, and fascia are all incised. Even the muscles will be separated. After the doctor incises the abdominal cavity, he will also incise the uterus. After rupturing the fetal membrane, the amniotic fluid is suctioned out. At this point, the baby's appearance can be seen. The doctor will carefully remove the baby, then cut the umbilical cord to let the baby completely leave the mother's body. Many people think that the cesarean section is over after the baby is born. In fact, that's not the case, because the doctor still has to deal with the parturient's uterus. After removing the placenta, the doctor will clean and stop the bleeding of the uterus. The surgery is not completed until the suture is finished. The parturient can finally have a good rest. The process and principle of vaginal delivery are quite different. Its process is mainly divided into cervical dilation, fetal delivery, and placenta removal. First is cervical dilation. The parturient will bear great pain at this stage. This is because the uterus will have severe contractions. This feeling will become more and more frequent. Many parturients suffer a lot. This stage will end until the diameter of the cervix exceeds 10 centimeters. Immediately following is the delivery stage. After entering this stage, the parturient will feel even worse, because the fetus will keep moving downward. When the fetus moves, it will squeeze the surrounding muscle tissues and nerves. The parturient will immediately feel excruciating pain. When the fetus's head reaches the birth canal opening, the parturient's pain will reach its peak. This feeling is like breaking several bones alive. The reason is that the diameter of the fetus's head exceeds 10 centimeters. The width of the body also exceeds the diameter of the head. Generally, the diameter of the birth canal is only 2 to 3 centimeters. That is to say, the birth canal has been dilated several times at this time. And this is not the most painful part. If the fetus is too large or the birth canal is not dilated enough, the parturient has to undergo an episiotomy. The fetus can be born smoothly only after making an incision in the birth canal. After the fetus is taken out by the doctor, the placenta still remains in the parturient's uterus. The doctor needs to remove it manually. Under normal circumstances, the placenta will gradually detach from the uterine wall under the influence of uterine contractions. The doctor can remove the placenta easily. But there is no guarantee that there will be no accidents if the placenta does not loosen at all. The doctor has to tear the placenta off forcefully. This feeling is like tearing off a piece of meat alive. This pain even exceeds that of childbirth. After reading this, don't you think mothers are great?